So Kristin, tell me a little bit about your background. As the Director of Rehabilitation Services, aside from being a director, which involves a lot of probably administrative and managing people and all that kind of stuff, what do you do on the clinical side of things? How do you help these kids?
Yeah, so my role is to support our rehabilitation services team. So physical therapy, occupational therapy, audiology, and speech-language pathology. I'm trained as a speech-language pathologist, so I do a lot of work with patients on feeding and swallowing and communication. Other members of the team are working on rehabilitation in terms of walking, crawling, running, jumping, writing. Our audiology team does a lot of support with hearing, as our chemotherapies can be ototoxic, meaning they can cause hearing loss. So do a lot of work in that area as well.
So for folks that are, that hear rehabilitation, that is a very wide encompassing title. Like you said, you just went through basically the physical, the occupational, the speech language, like there's so much involved in it. And a lot of different probably types of treatments and different how you help these kids. It really has to be focused to their needs.
Yep, absolutely. So children at St. Jude can have issues with walking, talking, eating, drinking, all sorts of things, whether that's from a surgery that they had, a cancer treatment that they've received, something like radiation, chemotherapy, maybe they had a surgery to remove part of their lower limb. And so we are there to support them. Our main goal is to help these kids feel like kids again and do the things that kids want to do. They want to be able to run. They want to be able to go to school with their friends. They want to be able to eat and have a mealtime with their families. And so our role is to support these kids in being able to do those childhood activities.
And the other, and a question that I would also kind of follow up with that is, I would assume that a lot of our patients come in and may be able to do types of certain things, but then after treatment, they may not be able to readily be able to do those types of things. And y'all's goal is to get them back to where they were, or at least close to it, so they can enjoy whatever activity that may be.
Absolutely. So a lot of our patients, before their cancer diagnosis, will be having a typical childhood, doing the things that typical kids do. And then these other things happen, and we have to help them get back to that. And so that's kind of our piece of the journey, is to help them, during their cancer treatment, where it can be really difficult to do some of the things that were easy for them before. And so we're working to help them, maintain some of those skills and gain some of those skills back so that they can do the things they want to do.
Also working with a lot of different age groups. So you
Absolutely.
have the newborns and infants, the 2 and 3 year olds, the toddlers who they don't really understand why you're making them do what they're doing. And so you need to make this engaging and fun in many ways. And we learned that on our tour, is that it's not just those typical physical therapy that if I'm recovering from a surgery that I may be told, hey, I need to go do this.
Right.
For the kids, it's a little bit more engaging, a little bit more fun, a little bit more creative. So
Yep.
you have to think about outside the box in many of those instances.
Absolutely. We are a creative bunch. A lot of the kids come in thinking it's playtime. They think this is great. We go to the waiting room and they light up when they see our faces because they're like, this is great. No ouchies here. We're going to play with a toy. I'm going to get a puzzle. We're going to shoot some basketballs. We're going to kick a soccer ball, whatever the case may be. But they don't really understand that we're also promoting a certain skill that we want to help them with. And so we get to be very creative and make sure that we're super engaging so that these patients want to come to rehabilitation services and participate in this thing that's actually supporting some of their function.
Do you find a regular occurring challenge in your job on the clinical side of things that that you run into, just an obstacle that you constantly run into, or something that you in your department that y'all are trying to overcome?
Rehabilitation services is an interesting group because we are expected to do a lot while these patients are on treatment. And when they're on treatment, they're continually having these peaks and valleys. They might feel good one week and then feel really bad after chemotherapy the next. And so we have to adapt a lot to however the child is presenting or feeling that day, that hour, that minute. And so that can be challenging because it's not like it's a consistent presentation. We have to really adapt and change and modify what we're doing and how we're approaching, these patients to make sure we're best serving them at that point in time. And that can be hard, but it's also part of being a skilled therapist, that, you know, that's what we're here to do for the families.
Yeah, it is your job, but also on the flip side, like I said, it's a challenge because you don't get to pick and choose. You know, when the patients are here, they're undergoing treatment. Like you said, you don't get to pick and choose, oh, let's just do this some other time, because they may need their treatment may be ending and they may be getting ready to go back home, or,
Yep.
you know, they may need another treatment. And so you have to kind of be persistent. And like I said, that probably means finding ways to motivate a patient that really just isn't feeling it for that particular day.
Yep, and it's a lot of conversations about, you know, what are we here for and what are we trying to help you do and what are your goals as a patient? You know, if they're old enough to verbalize, like, these are the things I really want to be able to do, well, then that's what we're going to work towards. So that's intrinsically motivating to you, even on the days that you're not feeling good, or, you know, you just went through something that was really tough. You know, how are we going to kind of overcome that, and how are we going to partner with you to do it?
And on the flip side of that, aside from the obstacles that you may run into, the hurdles that you run into on a daily basis, what are the things that you guys are really champion and that just bring a smile to your face as a therapist and as somebody that's rehabilitating these folks? What are the things that bring you into work every day, aside from the smiling faces of the patients, but what really motivates you?
I think that we are uniquely positioned in rehabilitation services to make connections with these patients and families. We usually see them multiple times a week. We're helping them with very meaningful activities, and so they really buy into what they're coming to see us for. And I think it's just such an important thing to support them throughout the journey. So watching, you know, whether it's myself and a patient and family or some of my team members working with these patients and families, it's just really heartwarming to see that progress and to know that what we're doing is extremely valuable and supportive to them, and that we are, you know, kind of a bright spot in this whole cancer journey.
Right, and there's a lot of this place creates bright spots, and it creates so many of them, but there's also got to be that gratification on your side of things when that one patient reaches that milestone or they reach that goal and you see that look on their face of, I didn't think I could get here, but I did it. There's got to be such a sense of accomplishment there.
So much. There's one patient in particular that I often think of when I think about, like, man, that's why I come to work. So I had a patient who had a tracheostomy, so he had to breathe through the tube in his throat. And when that happens, you're not able to vocalize very easily. And so there's a little valve that you can put on the tracheostomy to help speak when you have a tracheostomy. And part of my job is to help children learn how to use that speaking valve. He was really struggling with it initially. It can be very challenging to kind of, you know, get over the fact that, like, you're still going to be able to breathe. This is going to help you talk, but it can be challenging from a mental perspective. Mom had a really hard time observing those sessions, so she often stepped out. But we got to a place where he was getting a lot more comfortable. He was speaking more freely, and so I invited Mom back into the room, and I said, hey, what do you want to say to Mom? Like, what do you want to say? Hi, what's the first thing you want to say to her? And this was the first thing he said to his mom since his brain tumor surgery. She had not heard his voice. He said, I love you.
Oh.
And that's why I do it. That's why I'm here. I want to give children their voice back. I want to give the gift of parents being able to hear their child speak again. And we have moments like that every day. And I think that's what brings us all back.
Yeah, it's a soul brightening moment for sure. And then on the flip side of that, you talked about how a lot of the treatments are audio toxic, so it impacts hearing. So there's also got to be the other flip side of these patients for the first time hearing clearly their mom or their dad's voice after you know, days, weeks, months of treatment, and now it comes back, or you guys have worked back to rehabilitate that back. That's got to be another great feeling.
Yeah, everything we do in rehabilitation services is about participation, right? So whether that's being able to hear the people around you, being able to participate in a family mealtime, being able to say I love you to your family, being able to walk towards your sibling, that's what it's all about, is participation. And so we're really fortunate that that's kind of our goal and our piece of the mission at St. Jude.
There's so many instances too where a lot of us just want to, as patients or as patient families, there's a desire to return to normal, you know, or what a new normal may be. And for you, your goal is to maybe make that normal perhaps a little bit better than the original normal
Yep.
was, or to get as close as you can to that original goal.
Yep, and what does success look like for you now? What are your goals now? Because a lot of times people's perspective and their goals change throughout their cancer journey. And so how do we support you into living that fullest life, that fullest potential?
I also can't help but wonder how many how many patients have come and visited your department, and then they wanted to be an astronaut when they came in, but then they left and said, hey, I want to help. I want to be a speech language pathologist. I want to be a physical therapist because I want to help somebody just the same way.
And it's so fun to see, I might have treated a little baby and, 6 years later, they walk through the doors and I'm like, oh my gosh, I was helping you take your first bottle and now, you're in kindergarten, you're in first grade and you're thriving. And so I think that's such an important piece of rehab is we focus, St. Jude focuses on kind of on this survival type model, and rehab gets to be that thriving piece.
Right.
So how do we also thrive now that we're, living with cancer?
Yeah, because you're creating a quality of life for patients as they get out of the treatment or as they continue treatment. And like I said, it's not just about surviving, it's about thriving as well. When folks across the country or in our community see this interview, our Dream Home tickets will be available to be reserved. And if anybody's sitting on the fence right now and they want to reserve a Dream Home ticket or they want to donate to St. Jude, and they're kind of like, I'm not sure, what would you do to push them off the fence per se?
So I think something that's really important for people to know is that every donor dollar really does come back to the hospital to go straight to the patient. So from a rehab perspective, donor dollars are the reason why I can offer someone a wheelchair or the hearing aids that they need, or maybe some specialized seating or feeding equipment. That money supports my team in being able to do exactly what we need to do to support these patients, and it's invaluable. $1, $10, $100, that goes directly to us being able to support the mission of St. Jude.
Yeah, we talked about it earlier, a bunch of $100 tickets across the country equals one big ticket, and that's the one thing that everybody here is for, is everybody has the same mission. And like I said, those missions kind of, you go into the different subsets of that mission, whether it's surviving, whether it's thriving, whatever. And for folks that are at home and they're thinking about reserving these tickets or donating to St. Jude, the money really does go back, and it continues, this campus continues to grow and build and just get bigger and stronger. What's the future for rehabilitative services here? What would you like to see in the future?
I mean, we are a growing team. As we open new clinical trials, as we open new treatment spaces, we are accepting more and more patients, and so we're growing as a group. We're able to provide rehab services to more and more patients with different diagnoses. So we're getting into diagnoses that we've never seen before at St. Jude, and we're starting to accept them as patients here. So we are positioning ourselves to be able to support anybody who walks through our doors.
All right, Kristin, thank you so much for your time.